We're back here with another great patient testimonial, and this is a patient of mine for a long time, Allison, who, thank you for doing this. So she's been a patient of mine for a long time. Her patient number, she just told me, was what?
604.
604, guys. We're at 7,000. We were seeing about 330, so 2 years from when we started practice, probably back in 2004, which is wonderful, so thank you. When did you start care with Dr. Stone? 2004. So what for? How bad was it, and how was it affecting your life or well-being at the time?
Well, I was pregnant with my first daughter when I started care, and I just really I wasn't having anything major. I had had issues getting pregnant, and I just wanted it to be a smooth pregnancy and a smooth birth, and so I sought care. My mother-in-law was coming and she recommended me.
That's right.
And so I sought care, right, to kind of help that process of pregnancy be smooth.
Awesome. It is so wonderful to have you guys. Adjusting women who are pregnant through their pregnancy is amazing.
Yeah. And I mean, you know, like I went away for a long time. I mean, I think that there were some insurance things. We changed insurance and like it wasn't, you know, so I stopped coming for a while. And then when I returned like a year ago, I'm not somebody who's ever had chronic pain. That's never been something that I've dealt with.
Sure.
And I hurt my back. Who knows? Because I'm getting old, because I sneezed. Like, who knows? Yeah. I pulled something, and I was in some of the worst pain that I've ever experienced in my life. I don't know how people who have chronic back pain live with that every day, because I was in tears. I couldn't stand, I couldn't sit. Like nothing was comfortable. And I came back, and within 1 or 2 visits, right, and then adding in the massage, right, the FNMT, right, I started to have some relief. And I was like, you know, I have to make taking care of myself a priority. Like, this has to be a priority. And so I'm going to make it a priority.
Sometimes what I've learned, even through practice, is you have to let your patients experience their own experience. And when you're green, you're like, well, sometimes students come out and even I think of my friends when I was graduating from school, just want to browbeat, you know, you got to let your patients experience their own ways.
Right. I'll say that you know, I have never once doubted the care that I got. And so in that whole like almost 18-year span that I went without care, it wasn't because I didn't believe in it or I didn't think, like, it just was, I wasn't making myself a priority, right? I wasn't making that like a priority. And then when it hit, right, I was just like, I've got to do something.
Yeah.
And so I'm
glad you know that we were always here for you.
Yeah.
So always, that's another thing, you know, be here no matter what. So I appreciate that. That's awesome. That is awesome. Yeah. I'm glad you're feeling better.
100%.
Have I ever been another good source for Stone Chiropractic? Also been a good source regarding other health issues, or in any examples you can give?
I have 3 girls, as you know.
Yeah, this is, there we go. We can do
this. Like this, right? Like 3 girls, as you know. Amelia, in the last year, decided that she's going to be the tall one in the family, and grew in a year like 3.5 inches, which is a lot in a year time span. She's a dancer, right? Loves her dance. And last year she was really having struggles. She was all out of line in her hips, and she was having all this trouble in dance that she hadn't previously had. And we got her adjusted. We started doing physical therapy with her. And within all of that, we realized that she had one of her feet that is completely like flat. And so her ankle rolls in. Right. And so in addition to chiropractic care, the physical therapy that we were doing, we used your recommendation, right, for the podiatrist to take a look at her ankle, make sure that there was nothing else going on, to build some specialized inserts for her to really help that condition. With your help, right, being able to find those other things and that other care by good people that we needed.
Build your network with good people. And functional neurology, you guys are going to end up graduating with some people who go on to become functional neurologists. It is so nice to have these aces in the hole. So when you've got active families or athletes, that the kids are growing, the bones grow faster than the muscles. So all of a sudden, even a kid that's not an athlete will have the stress of the muscles and the pain from that, but then you throw in movement and all that stuff, and the chances for soft tissue strains go up. So having your kids in there and being chiropractors to kids that are, as they go through the growing spurts is so important.
Important to me to know is like, number one, I trust you. And so I trust your judgment, and I trust, so if you say to me, somebody's good, right? Like, I trust that.
Good.
And I trust that I can go to them and do that. So in feeling like you set your network up with these other doctors, right? And say, okay, I would recommend this person or this person. Like, make sure that they're like-minded with you, because I trust you. And so, like, I have that expectation that when I visit one of these people that you recommend, that I'm gonna get the same kind of care that I get from you.
Make sure, like Allison is saying, that when you refer, you want to make sure that they're going to have a great experience, they're like-minded, and that could not have been a better thing to bring up. That is awesome. How important is, on that level, is it for a doctor to have compassionate care, on a positive personality and a desire to educate? Being an educator.
Right. My husband has Crohn's and has a gastro doctor that I personally, as the wife, am not in love with. I feel like every visit is just, how short can I make this? How quick can I get through this? It's a burden to ask questions. I'm like moving, like, we have learned that there can be good doctors who care and are compassionate.
As these guys go off and post some wisdom, as they go off into their practices, anything that you could recommend, you've kind of done it. I think definitely the clear message of being thorough, being understanding, listening to your patients, but anything you can kind of leave these guys with before they go off. What do you think?
What I appreciate is, again, like, coming back to you after 18 years and being in like this terrible, like, pain, and we did the initial x-rays, we did all of those things, right? We had the initial adjustment, and then, I came and, you did like your little teaching session here or whatever. You kind of set it up as a plan, and like, this is, right, how many you can do to kind of fix the problem. And here's, if you really want to be better, then this is what it is. But I never felt pushed. I never felt that you were like, oh, well, I guess then you're going to be the loser.
Do not do that to your patients.
Right? But like, that not pushing and just being there, and you've got to have that compassion. I don't ever walk in here when I'm not greeted by name. They know my kids. They ask about how things are going. They know about my job, even after 18 years. And I never, ever feel like I'm not important. And I can't begin to express how important that is for people.
Amen. Thank you.
So,
that's ultimately what I wanted this clinic to be, and I'm glad to hear that.
Yes.
I love you. You guys, it's so important. No matter what, you got to figure out ways to make sure that you're there. No matter how many patients you see, there's ways. You have to be intentful in the way you set your practices up, having the tools. But thank you from the bottom of my heart.
Yes.
And thank you for doing this.
No problem. Thank you.
Oh.